Welcome to the Depth Dive. Today, we're really getting into something fascinating in immunology. It's about how something we thought we had figured out is actually being completely reevaluated, especially in the fight against cancer. Imagine like a secret agent, always known for one specific mission, suddenly revealing they play this totally different vital role in a huge battle. That's kind of what's happening with what's called type 2 immunity. So this deep dive is based on a really important review article from Nature, just out in January 2025. It's titled Reinventing Type 2 Immunity in Cancer by Marek Wagner, Hiroyoshi Nishikawa, and Shigeo Koyasu. Now, for ages, type 2 immunity was, well, mostly known for fighting off parasites and helping tissues repair themselves. Pretty standard stuff. But there's new evidence painting a much more complex picture. It's challenging this old idea that maybe, just maybe, it might even help cancer grow. So today our mission is to unpack this transformation. Could type 2 immunity actually be a powerful ally against tumors?
It's really quite remarkable, isn't it? How our understanding has genuinely shifted, I'd say, quite substantially in just the last few years. I mean, beyond that classic role defending against parasitic worms, Hellman's type 2 immunity seems to have these other jobs, functions that were perhaps underappreciated before but are now really coming into focus.
Okay, so let's start with the basics then. The canonical roles, as the paper calls them. What are those traditional jobs everyone learned about?
Well, the primary one, the textbook function, has always been defense against those parasitic helminth infections. Think larger invaders like intestinal worms. Your body needs a specialized team, basically, to kick them out. And the key players, the signals involved, are specific immune molecules, cytokines we call them, especially interleukin-4, IL-4, and interleukin-13, IL-13. They're like the chemical messages driving that whole expulsion process.
Right, get rid of the big parasites. But you mentioned tissue repair too, so it's not just defense.
Absolutely not. That's another really critical function, regulating tissue repair. Imagine after an injury, you need a cleanup crew, right? And a reconstruction team. Type 2 immunity sort of orchestrates that. Things like healing skin wounds. And specific cells, like these group 2 innate lymphoid cells, or ILC2s, are really central to that healing process.
ILC2s, okay. And you mentioned fat tissue. How does immunity tie into that?
Yeah, it's maybe less intuitive, but type 2 immunity is also involved in maintaining the balance, the homeostasis of our fat tissue, our adipose tissue, which really shows it has a systemic influence. It's not just acting locally where an infection or injury is. There are specific cells within fat tissue, actually identified early on by different names, but later recognizes ILC2s that help maintain that balance.
Okay, so we have these ILC2s popping up again, and cytokines like IL-4 and IL-13. Can you flesh out the main characters on this type 2 team a bit more?
Sure. The ILC2s, you can think of them as the rapid response unit. They're part of the innate immune system, the first line of defense, and they churn out these key type 2 cytokines. We mentioned IL-4 and IL-13, crucial for parasites. But there's also IL-5, IL-25, IL-33, and TSLP. That's themystromal lymphopoietin. Quite a mouthful. These are all signaling molecules coordinating things. IL-33, for instance, is a really potent activator of those ILC2s. And then you have mast cells. Think of them as the alarm bells. They're really important for getting the ILC2s going and helping clear those worm infections.
Okay, that paints a clearer picture of their day jobs. But here's the twist the paper talks about this negative perception. Why was type 2 immunity sometimes seen as, well, potentially bad for cancer if it's usually protective?
Right. That perception largely comes from the downside of chronic inflammation and constant tissue repair. While inflammation is necessary to fight infection or heal if it goes on too long, it can create an environment that might actually help cancer cells get a foothold and grow. It's like a building site that's perpetually under construction eventually. Problems can arise in that chaotic environment. And this idea isn't just theoretical, it's reinforced by actual cases where chronic parasitic infections, the very things type 2 immunity fights, do lead to cancer.
So the fight itself, if it goes on too long, can cause collateral damage that helps the enemy. That's,
Yeah,
a paradox.
exactly. Take liver flukes, for example, like Opisthochus viverini. They're strongly linked to bile duct cancers, or Schistosoma hematobium, another parasite, linked to bladder cancer. And the mechanism is quite telling. These parasites can actually secrete substances, like growth factors. Opisthochus secretes something called granulin. It makes the host's own cells divide more and encourages new blood vessels to grow, angiogenesis. Essentially, it creates this perfect little pro-tumor environment. And studies in mice show if you block that granulin, you actually hinder the development of cancer.
Okay, let's do a quick recap here. So type 2 immunity's traditional playbook. 1. Fighting big parasites like worms. 2. Patching up tissues after injury. 3. Keeping fat tissue in balance. Key players include ILC2s, mast cells, and cytokines like IL-4, IL-13, IL-33. But there's this shadow, this lingering idea backed by some nasty parasite examples that the chronic inflammation it involves might accidentally help cancer along.
Precisely. Which really sets up the central puzzle this Nature review tackles. If its core functions can sometimes seem to aid cancer development, how on earth could it also be protective? And this is where the science gets really exciting and, well, challenges everything we thought we knew.
Right, this is the reinvention part. The paper argues against that old negative view, suggesting type 2 immunity might actually protect against tumors or even actively suppress them. A complete flip from potential bad guy to potential good guy.
It's a major shift in thinking. We're finding that many of those same players, ILC2s, eosinophils, the cytokines, have this hidden anti-tumor side. It's like discover your quiet neighbor is secretly a superhero.
Okay, tell us about this anti-tumor arsenal then. How do these components actually fight cancer? Let's start with those ILC2s again.
Well, newer studies are showing ILC2s can directly kill tumor cells. One mechanism involves inducing something called granzyme B-mediated cell death. You can picture them as little snipers, picking off cancer cells in the tumor microenvironment. And what's possibly even more exciting is that they seem to amplify existing cancer treatments. Take PD-1 blockade, a common type of immunotherapy. In melanoma, blocking PD-1 seems to unleash anti-tumor immunity that depends on these ILC2s, so they could act like a booster, making current therapies work better.
A booster for immunotherapy. Wow. And you mentioned colorectal cancer too.
Yes, studies suggest ILC2s can protect against the progression of colorectal cancer, and their presence is linked to better survival for patients. So they're not just killing cells, they seem to be holding back the disease overall in some contexts.
But tumors fight back, right? They try to shut down immune cells. How do ILC2s deal with that?
They absolutely do fight back. Tumors create this suppressive environment. We mentioned lactic acid before. Tumor cells produce a lot of it, and it can directly reduce the number and function of these helpful ILC2s that get exhausted. But researchers are looking for ways around this. For example, targeting a specific pathway involving a protein called LKB1 seems to prevent ILC2 exhaustion. If you can keep the ILC2s energized, you can potentially enhance the anti-tumor response.
Yeah.
It's like keeping your soldiers supplied and ready.
Okay, ILC2s are definitely sounding like heroes now. What about eosinophils? You mentioned them, but I still mostly think allergies.
Yeah, that's the common association. But this is another surprising twist. Eosinophils can actually kill tumor cells directly, too. They use weapons like TNF-alpha and granzyme A. This has been seen against colon cancer cells, for instance. But perhaps even more intriguing is their role in fixing the tumor's plumbing, so to speak. They can help normalize the chaotic blood vessels often found in tumors.
Normalize the blood vessels. Why is that important?
Well, tumor blood vessels are often leaky and disorganized. This actually makes it hard for other immune cells, like the really important CD8 plus killer T cells, to get inside the tumor and do their job. The eosinophils seem to help make these vessels more like normal vessels, essentially clearing the roads for the T cell cavalry to arrive.
Ah, okay. Paving the way for other immune cells. That makes sense. So does seeing eosinophils in a tumor tell us anything about the patient's outlook?
It seems so. The presence of what's called Tate tumor-associated tissue eosinophilia often correlates with a better prognosis. This has been observed in several cancers, like melanoma, colorectal cancer, and some head and neck cancers. Higher eosinophil counts are often linked to better survival and better responder to immunotherapy. And they don't work alone. They can team up with other cells, like certain T cells producing IL-5, to boost the response to treatments like checkpoint blockade in breast cancer. Their activity can also be ramped up by IL-33, that cytokine we mentioned earlier.
Fascinating teamwork. And you also mentioned Th2 cells briefly before, another type of T cell.
Yes, Th2 cells are a subset of helper T cells. Traditionally, like the rest of type 2 immunity, their role in cancer was viewed with suspicion. But again, newer evidence suggests they can inhibit the growth of cancers like colon and pancreatic cancer. They seem to do this partly by encouraging anti-tumor activity from macrophages and those eosinophils we just discussed. And what's really compelling is that in some studies, taking tumor-specific Th2 cells, growing them in the lab, and giving them back to the patient at adoptive transfer has actually led to tumor eradication.
Wow, eradicating tumors. That's serious potential. So individual cells are fighters. What about the signals, the cytokines? Do IL-4, IL-13, and the others have direct anti-cancer roles too?
They certainly seem to. IL-4 and IL-13, beyond the parasite role, can actually inhibit angiogenesis. They can choke off the tumor's blood supply. They've also been implicated in tumor rejection in mouse studies. And IL-13 seems to help protect against skin cancer development. Then there's IL-25. It seems quite targeted. It can directly trigger apoptosis, that's programmed cell death, specifically in breast cancer cells that have the receptor for it, while apparently leaving healthy cells alone. And TSLP, that other cytokine, seems to create an anti-tumor environment in the skin and might even block early stages of breast cancer formation.
Okay, let's try another quick summary. We've gone from type 2 immunity maybe being a problem to potentially being a major solution. We've got ILC2s directly killing tumor cells and boosting immunotherapy. Eosinophils killing tumors and fixing blood vessels so killer T cells can get in. Their presence is often a good sign. Th2 cells inhibiting tumor growth and showing potential for adoptive therapy. Cytokines like IL-4, IL-13, IL-25, and TSLP having direct anti-tumor effects, like cutting off blood supply or triggering cancer cell death. It's a complete turnaround.
It really is a paradigm shift. But of course, it immediately begs the question, if this anti-tumor machinery exists, why does cancer still develop and progress? Why isn't it always effective? And crucially for the future, what can we do to help it work better?
Exactly. That leads us to the challenges. If type 2 immunity can be so good, what are tumors doing to stop it? How do they evade this potential ally?
Tumors are, unfortunately, very clever at manipulating their local environment, the tumor microenvironment. We talked about lactic acid exhausting ILC2s. That's one strategy. Another key player is a cytokine called TGF-beta. It's well known for suppressing immune responses generally, and it definitely puts the brakes on type 2 immunity against cancer. And there's also this concept of plasticity, particularly with innate lymphoid cells like ILC2s.
Plasticity, meaning they can change.
Exactly. Their function isn't fixed.
Mhm.
Depending on the signals they get from the surrounding tumor environment, they can adapt. This adaptability could be good, allowing them to respond effectively, but it's a double-edged sword. The tumor can potentially send signals that reprogram these cells, maybe even making them switch from fighting the tumor to, well, ignoring it, or perhaps even helping it in some ways.
That's tricky. So the tumor environment itself is a major hurdle. How does all this new knowledge then feed into improving cancer treatments, particularly immunotherapies?
Well, the potential is enormous. That finding about ILC2s amplifying PD-1 blockade, that immediately suggests strategies to combine therapies or prime patients for better responses.
Yeah.
And it's not just PD-1. Even with very advanced therapies like CRT cells, which involve engineering a patient's T cells, there are hints that type 2 immune functions might be important for achieving long-term remission, for example, in leukemia. There's also research on using modified type 2 cytokines, like a version of IL-4 called FCIL4, to actually reinvigorate exhausted killer T cells, give them their fighting power back. The review even touches on this idea of immunogenomic cancer evolution, suggesting this constant dynamic back and forth between the tumor's genetic changes and the immune system's response, including type 2 immunity. It's incredibly complex.
Wow, and it seems the complexity doesn't stop there. The paper mentions other cells in the tumor neighborhood whose roles are also being reevaluated, right? Like fibroblasts.
Absolutely. Cancer-associated fibroblasts, or CCAFs, often they're just seen as bad guys, helping the tumor structure and grow. But it's more nuanced. Some specific types of CCAFs might actually inhibit certain cancers, like pancreatic or oral cancers. They might do this by suppressing the stemness of cancer cells, or by producing collagen that walls off harmful substances, or even acting as tumor suppressors themselves. It really depends on the specific type of CCAF.
So not all fibroblasts are created equal in the tumor world. What about mast cells? We heard they can ring the alarm, but is their role also complex?
Very much so. We mentioned they help initiate ILC2 responses, which sounds good, but other studies show they can promote pancreatic cancer growth. Yet, paradoxically, in melanoma, having low numbers of certain types of mast cells is linked to worse survival. So their role seems highly dependent on the cancer type, the specific type of mast cell, and probably many other factors we're still figuring out. It's definitely not straightforward.
Okay, so the context is everything. And what about B cells? I usually think of them making antibodies.
Right, but B cells are also important within the tumor itself, often found in these organized clusters called tertiary lymphoid structures, or TLS. Think of them like mini-immune HQs setting up shop inside the tumor. The presence and activity of B cells and TLS are increasingly seen as really important factors influencing how patients respond to immunotherapy. They affect the types of T cells present and the overall immune environment.
So pulling this all together, what's the big message for people listening? How does this shift in understanding potentially change the future of cancer treatment?
I think the biggest message is that the immune system is incredibly intricate, and we're still uncovering its layers. Type 2 immunity is a prime example. Moving beyond the simplistic good versus bad view And appreciating this nuance that it has potent anti-cancer abilities alongside its other roles opens up entirely new therapeutic avenues. You can start thinking about strategies to specifically boost the helpful aspects of type 2 immunity, maybe dampening the unhelpful ones, perhaps finding ways to overcome the tumor's suppression tactics. The goal is ultimately to harness the body's own defense systems more effectively and hopefully develop smarter, kinder cancer treatments.
It really has been an incredible journey today with diving into type 2 immunity. We started with the system known for fighting worms and fixing cuts, and ended up revealing it as a potential powerhouse in the fight against cancer, a true reinvention story.
Absolutely. The key takeaway for me is just how complex and multifaceted immunity is. Type 2 immunity, once kind of sidelined or even viewed negatively in the cancer context, is clearly showing its anti-cancer credentials. Understanding the details, how tumors try to shut it down, how different cells cooperate, how we might be able to boost it, that's where the progress will come from.
So here's a thought to leave you with. If our bodies already have these amazingly versatile immune tools like type 2 immunity, just waiting to be fully understood, how much better could we fight complex diseases like cancer simply by learning how to properly unleash their surprising potential? And what other biological systems, maybe overlooked right now, might hold similar keys to future breakthroughs?